Hello, Dr. Vikki Petersen here. Today I wanted to speak with you about IBS. April is IBS month, and increasing awareness about this disease or syndrome is really critical. 20% of Americans are affected by IBS. IBS stands for irritable bowel syndrome, and the symptoms associated with it are fairly chronic diarrhea interspersed with constipation, but the people that suffer are often housebound. This disease can completely ruin people's lives because maybe most of us have experienced like an intestinal flu or getting food poisoning, and you know that feeling of literally being chained to the bathroom because you never know when your bowels are going to need to move, and it can be very, very stressful. So we here at the clinic have excellent success treating IBS, and I don't say that at all lightly. As I said, it's a miserable disease or syndrome, depending on what you want to call it. And what happens is that when people are diagnosed with IBS, they are told that there is no cure. And I can't state there's a cure because that would be stating that every single person that came and did our protocol got 100% results. So I'm not saying that, but what I'm saying is that we really have very, very excellent success. So meaning a large number of people do get rid of their IBS. And how does that work? In the medical model here in the U.S. is very symptom-oriented. So we tend to see a symptom and then try to counter that with some sort of drug or medication. And IBS is no different. So when someone has the unrelenting diarrhea, they're given something for that. And then when they swing back to the constipation, they're given something for that. They're also often given anti-anxiety medication or antidepressants because those type of symptoms tend to come along with IBS. In my opinion, it's often told to a patient that the reason they have their IBS symptoms is their depression or anxiety, and I feel it's the opposite, meaning you have the problem and then as a result of that you get depression and anxiety, which is what I see in my patients. So that's why I'm giving that as my opinion. So you have a bowel that's irritated. Clearly that's occurring. But why? So what we do is we try to get to the root cause of where those symptoms are coming from rather than simply masking them with a medication. There are four sort of key areas that we have found. Number one, it's very common for someone to be gluten intolerant, and removing gluten is a very, very common stressor causing these symptoms. Very close on the heels of gluten intolerance is a dairy intolerance, so that's also very, very common that people are reacting improperly to dairy and having that reaction causing the symptoms. Third, it's very, very common for people to have an infection, an intestinal infection. That can be found by a stool test, at least that's how we do it here at the clinic. And when that infection is treated, along with the dietary changes, lo and behold, they're doing great. And to really round that out, the fourth thing is looking at the good bacteria, or looking at the health of the GI tract as a whole, healing any leaky gut, getting the good probiotics reestablished. So it really is looking at the health of the intestine. And you know, so often I have patients who are diagnosed with IBS and they ask their doctor, well, what should I do with my diet? And they say, oh, it doesn't have anything to do with diet. I mean, does that make any sense? You know, you're talking about your digestive organ and it's extremely irritated and inflamed. How could it not have something to do with your diet? I have honestly never found that to be the case. I mean, I've been practicing for close to 25 years now. I haven't met a single case of IBS where their diet had absolutely no relevance to their symptoms. So I highly disagree with that, and we do see here at the clinic it's a very, very treatable condition if you're willing to change your diet. You definitely have to be willing to do that, but why not? You know, look at the results. Not only are you not chained to a bathroom and have these miserable symptoms, but do understand the importance of the gut itself. It's called the second brain because it's second in importance to the brain as far as your organs are concerned. And why is that? Why is it given such a high importance? Because it turns all your food into fuel and it feeds all your cells. You've got 10 trillion cells that you have to feed and keep healthy in order for your whole body to be healthy. So of course it makes sense to really have a healthy GI tract. So if you know anybody with IBS, please pass this along to them. Too many people are suffering thinking there's no cure because that's what they're told, and they just live with medications depending on their having constipation or having diarrhea, often being treated with anti-anxiety, antidepressant medications, not getting to the root cause. So please share this with those you know who are suffering. Likely you know someone with 20% of the population suffering. Until next time, I wish you very good health.